Imagine a remarkable transformation. A doctor using the most advanced technology in the world. Experienced people making someone feel right at home. Working together to make the world a better place. Imagine all these big ideas set into motion. One hospital is changing the way people receive care for people who matter most. You. The new Broward General Medical Center.
My father is 70 years old, was treated poorly after visiting hours. Please don't bring your parents or grandparents for treatment or for admitting. After visiting hours are over the hospital, don't check up on the patients who can't speak for themselves. No food or drinks is given, no medication. Don't answer the patient buzzer button. The RN nurse name Ashley, nighttime shift 6-4 building 6, was very rude and no proper care for my father. 10/08/2022. Night shift RN, please look at the photos. My father room very dirty, and he could have even reached his phone because it was on the floor. Also, the nurse never take my elderly father a shower or change his urinal cup. His throw up was never cleaned. No medication for pain. This whole night staff should be replaced, starting with the nurse. RN Ashley, nurse 6th floor, 6 tower night shift. RN nurse, please suspend or fire her. Accident 10/08/2022. That's extremely specific for them to put the person's name and everything like that. So I guess it's just generally untidy. Yeah, I see. What a horrible experience it was. Everybody at the ER is extremely rude and careless. Hospital is super understaffed right now. Must be for a reason. 5 hours just waiting to get in after originally coming in for a split open chin with foot and knee bruises. The guy at the front desk used his commonly used line, if someone has chest pains, I have to prioritize them first, which is fine. But then you have an older gentleman with chest pains come in and you tell him that there's a 2-hour, 18-minute wait? Ridiculous. Place is dirty, smelly, people with legit emergencies waiting while they're just letting the easy ones in to get it out of the way. This was discriminatory and disrespectful. That kind of poor customer service this hospital has. Close it now. It is not safe. Okay. I just got home from a 2-night stay at this pathetic and abusive hospital. I would give it 0 stars if I could. I was transported by ambulance from a cruise. The ER nurse was kind and helpful, but the hell started once I was admitted. First of all, the doctors did not listen to me or read the packet of info provided, which was an incident report of what had happened. The ER visit would have been sufficient as they ran tests and scans and all was good to go. However, once admitted, I only saw one doctor in the 48 hours I was admitted, who lied and told me, in fact, been seen by another doctor. Then every nurse, except for the one that I had the last night who discharged me, was rude, talked over me, did not take precautions when it came to my medicinal and allergies, and in general were just horrible examples of medical professionals. The room and bathroom were never cleaned while I was there, not once. There was a slime of grease and hair caught in the hinges of the bed I laid upon. The sheets and blankets felt like they were one step down from paper towel. I don't know if the nurses ever washes their hands. It was filthy. It was worse than what I would expect a prison infirmary to be. Run, run, run far, far away from Broward Health Medical Center. Run.
Broward General is one of the 5 hospitals that we have. We're a major trauma center. We just added on to where we're at the atrium now within the last 2 years. Our basic main goal here is to be a leader in the community as far as healthcare and providing for our clientele, whether they have insurance or the non-insurance patients.
Sometimes you don't know where you want to be when you get here. You have no idea where you want to go, what you want to do. And then you find that unit or that family of staff members that make you say, this is it, and this is where I want to be. You work well with your patients, your doctors, and it makes you just want to foster that and just want to stay here and develop into something great.
Broward General has a lot of growth. Like I said, we just added on to the new atrium. We have cardiac cath center. We're doing now liver transplants. They try and, if they can work with you to help you put you in shifts, that will help you to be able to get an education to another field if you want to go into it. So they're very accommodating and flexible.
A year ago. I found the treatment and service in the emergency room was great. Unfortunately, I was moved to 3 North Tower. Here, things fell apart. The place is dirty. They forgot to give me a pillow or tell me how to call the nurse if I needed her. There's probably good reason for this, as they do not want to give you the time of day. I have been here 2 days now and still have no idea about any of the tests I have done. I do not know if the tests are good or bad or any idea how long I might be here. They keep telling me I will be gone. It would be fine if I wasn't a single dad who has 2 children at home who are very worried as their mother passed away here 1 year ago. Wow. I went to the ER at 4:30 p.m. The waiting room, patient's room, and hallways were very dirty and the bathroom was disgusting. I was not called for vitals until 7:45 p.m. I was given a cup to pee in and told to keep it with me until I was called back. I was not put into an exam room until 10:30 p.m. Once I was in the room, the physician did not see me until 11:40 p.m. He then ordered some tests that took another 2 hours. I was discharged at 3 a.m. and told to follow up with my primary doctor. I felt even worse than when I had came in. This hospital has gone downhill. The staff are very unprofessional and rude. The wait time is extremely ridiculous. Due to the fact I was not feeling well, I went to Holy Cross Hospital later that day. I was admitted and spent a week in the hospital. I cannot believe Broward Health sent me home in the first place. I will never return to any Broward Health hospital or recommend it to anyone. 2 years ago, I was visiting from out of state when I unfortunately ended up having to take an ambulance to the hospital. The staff was not kind or compassionate. I could hear the nurse in the hallway saying my friend was crazy and someone needed to let her in. The front desk receptionist was awful. We asked her to call a taxi because both our phones were dead. As she rolled her eyes and made us think about it, she did. I was sitting down because I had low blood pressure. The receptionist told us we needed to be outside waiting. As we were outside waiting on the curb, she came outside to yell at us to inform us we had to be outside. Clearly we were. I also found it odd they don't educate what their tests are. I declined a CAT scan. They said fine, instead of letting me know what a CAT scan will show. Overall, it was a horrible experience. The only person who was good was a kind man at the end getting my health insurance to discharge me. Okay. A year ago. Once you enter this hospital, expect to leave in a body bag. My mother was admitted for a fall. Since I live out of town, I called every day to make sure she was getting her 5 heart medications. I was repeatedly told she would get them, but 9 days later, she still did not have her medications, despite the fact they were faxed twice. The social workers lie or hang up on you, won't spend a minute to discuss your family member. The doctor that was assigned to her wasn't told she was his patient until 9 days later, and only then did she receive her medications. By then it was too late, and she passed away from cardiac arrest. I was told my mother was in stage 4 renal failure. Then why did the death certificate say she died from hypertension and heart disease? And I almost forgot to mention the hospital claimed my mother had COVID with no symptoms when she arrived and kept her in total isolation. They continued to say she had COVID for 12 days. Hospitals are hoping the patients will die from COVID as they are paid big money by the government if that occurs. Do not send your loved ones to this hell on earth. Jesus, that is fucked. A year ago. Worst medical facility I've ever been to. Nurses, hospital staff referred to me as diarrhea girl outside my room. Completely disrespectful and disgraceful, especially as someone who was ill in the waiting room for 3.5+ hours. The overall hospital was dirty. The medical staff helping me seemed disorientated and confused. I left feeling worse than when I came in. The only silver lining was the man wearing a mustard sweater at the front desk. He was an angel.
Wherever you live in Broward, there's a Broward Health facility close by. From Broward Health Weston to Broward General and Chris Everett Children's Hospital to Imperial Point Medical Center, North Broward Medical Center, and Coral Springs Medical Center. We're more than 8,000 healthcare professionals focused on better health for everyone who lives here. Broward Health. Powerful medicine.
A year ago. Oh, where to begin? This facility should be shut down. My mom fell while on vacation and was brought to this facility by ambulance. She injured both ankles and they took x-rays that were negative. Upon putting her in a boot and attempting to have her stand, she was still non-weight bearing. I was out of town and she was updating me by text. I suggested a CT to make sure the x-rays didn't miss anything since that happens, and she was told we don't do extremity CTs in the ED, which is ridiculous. They eventually did the CT and found both ankles were fractured. Skip ahead to the middle of the night. My mom has been admitted and is being told by nurses that she will be having surgery on her left ankle. Remember that, it's important later. At no time has anyone reviewed her images with her, and no surgeon has come in to speak with her regarding what exactly they plan on doing. My mom decides she doesn't want surgery there and would like to return home to be near family. Upon expressing this, she was told there was no way for her to be transported, untrue, and that if she signed herself out AMA, Medicare wouldn't pay her medical bills and she'd be stuck paying out of pocket, also untrue. She finally encountered someone reasonable, Dr. Sherman, I believe, who was able to facilitate her desires. She is now home and has received a second opinion, which concluded her right ankle was worse than her left and no surgery was indicated. This hospital was essentially trying to bully my mom into a surgery that was not indicated, I can only assume for the Medicare reimbursement. A formal complaint with CMS is forthcoming. Do not let this facility touch you. Jesus. Alright, a year ago. Awful facility. If I could give it 0 stars, I would. Disrespectful and unprofessional staff. You can get better diagnosis and treatments in the morgue than at this place. They are quick to discharge a patient before properly treating them. Then what's the point of a hospital if a person leaves in a worse condition than before entering? Packages at an Amazon warehouse get treated with better care than people do at this here clown facility. 2 years ago. I just recently moved to the state of Florida and my boyfriend had to have an emergency surgery yesterday evening. I left him after the procedure for an hour to get him some clean cloths. Came back, found him crying in pain, saying he's been pressing the button for the nurse after he woke up and no one came, and one of them came and yelled at him to stop pressing it so much. My boyfriend does not speak English. He was in relief to see me. Shame on the nurses of this hospital. Your job is to make the patient feel comfortable. Disgusting, really. 2 years ago. This hospital is going to allow nursing students to bring all their germs from the outside world into the rooms of our loved ones. This is not the time to allow students who aren't licensed and unnecessary personnel into the hospital. We're in the middle of a pandemic and you want to allow students to risk their lives. Of course, only a hospital with such low standards would allow something like this to occur. Why aren't any of the other hospital systems allowing students in? It must be for a reason. So why would you allow something like this to happen? I'll be making a report with the Joint Commission as well. I believe this is something that needs to be looked into. 2 years ago. Absolutely -100. Upsetting, unexpected, and unexplainable. I just observed several key personnel come into work the beginning of their shifts entering from the outside of the facility, not wearing a mask, and after being verbally challenged by the receptionist that they needed to have a mask, continued walking into the facility. Yes, I am very upset. This was a security person and what appeared to be a medical person. So, I call HR, and after explaining my concerns, she blindly transferred the call to customer service. Is this newsworthy? This is horrible. 2 years ago. I am really sick and was submitted to the ER and everyone was super mean, rude, and combative. Not to mention they were all overweight. You can't be mean and fat. You have to pick one. You can't be both.
Broward Health Medical Center is a 716-bed acute care hospital that is home to virtually every medical specialty. It has been committed to providing award-winning quality care to meet the healthcare needs of the community for more than 80 years. With board-certified and board-qualified emergency medicine physicians, nurses, and support staff, the 24-hour emergency department offers specialized services to adult and pediatric patients, a fast-track program for less critical patients, and advanced cardiovascular care. It features a Level 1 trauma center equipped to care for the most complex cases in both children and adults. The newly renovated and expanded Sala Foundation Children's Hospital at Broward Health Medical Center offers the full spectrum of pediatric specialty services in a compassionate, family-centered environment. Prepared for the most specialized cases, the Children's Hospital includes a Level 1 Pediatric Trauma Center, a Level 1 Pediatric Intensive Care Unit, and a Level 3 Neonatal Intensive Care Unit. The perfect place to celebrate the birth of your baby. Maternity Place offers private labor and delivery suites, private postpartum suites with luxurious shower facilities, and full-size beds with pillow-top mattresses. Deluxe Empress Suites offer extra spacious family areas. Maternity Place combines the luxurious amenities of a hotel with the comfort of home while providing exceptional care for the entire family. The Lillian S. Wells Women's Health Center combines a spa-like atmosphere with advanced technology, creating a serene space for a range of women's diagnostic imaging services. It features a sensory suite, an anxiety-reducing mammography experience, as well as a private entrance. The Comprehensive Cancer Center offers a multidisciplinary approach to the detection and treatment of cancer, utilizing the latest medical advancements in a compassionate environment. Patients have access to a variety of services, including genetic testing, radiation and surgical oncology, support groups, and survivorship programs. The Cardiovascular Services Department provides a comprehensive approach to the detection and treatment of cardiovascular disease. Services include angioplasty, cardiac ultrasound, EKG, pacemaker and defibrillator insertions, and stress testing. Minimally invasive robotic surgery at Broward Health Medical Center is designed to offer greater precision and flexibility for colorectal, general surgery, gynecological, thoracic, and urological procedures. Possible benefits for the patient include less pain and scarring, smaller incisions, and quicker recovery times. The South Florida Transplant Center offers patients with end-stage liver disease, cancer, and organ failure the chance to live longer, more active lives. As the first liver transplant program established in Broward County, the center's multidisciplinary team works together to provide personalized care for all medical and surgical aspects of transplantation before, during, and after treatment. When looking for high-quality, compassionate care, you can depend on Broward Health Medical Center.